And I would invite Rana to come and talk about it and tell why he hated those legacy pipettes, right? Am I saying it right?
Yeah, more or less.
Yeah, two physicians in the room confirm that's the right pronunciation. So come on in, micropipettes.
Hi, I'm Rana. I just want to say that I'm sorry because there's no actual demo happening today. My co-founder and I are building the demo device and we're filing our provisional patent right now. And until the provisional is filed, you guys are getting nothing out of me. So you get this video and it's like, you'll play the audio, right? Yeah, it's me talking in the video, so. Hi, my name's Rana, co-founder of Tuby Bio. We are reinventing the most widely used lab device in the world, the micropipette. So I did an undergrad in biochemistry and worked in a bunch of labs using manual micropipettes with my thumbs, and I hated every second of it. So micropipettes are the most widely used lab tool. They do the fundamental action, which is move microliters of liquid around, but they haven't changed since the 60s. So there's a picture of then and now. So this is Eppendorf's official data of a freshly calibrated micropipette. The central bar is a target, 100 microliters, plus minus a quarter microliter, and it only hits that 13% of the time, which, if you ask me, is not good enough. There's plenty of papers on the inaccuracies of piston-based liquid handlers. This one had a 2 microliter difference. This one showed that a 2 microliter difference between samples could result in a 91% difference in protein detection. So you better calibrate your pipettes. So micropipettes are little more than syringes with a gear train attached to them. There's a plunger, which is here, and the stroke length of the plunger inside the piston is regulated by this gear train of the dial counter, of the volume selector. And that's where we're at in our cutting edge technology, a syringe with a gear train. So they're inaccurate because those gears have tiny gaps between them, this part in red, called mechanical slack or mechanical backlash. And every mechanism needs those little gaps to prevent jamming as the components turn on each other. The only way to get high precision is to decrease that gap, which requires more and more expensive machining as the gap gets smaller and smaller. So what's the deal with pipettes? They're expensive. They're inaccurate. They need calibration. They fail unnoticeably. And that's Jerry Seinfeld for us old folks in the room. The young kids probably won't recognize him. So we made a new sensor that can measure microliters way more precisely. So our sensor can do 50 times more precision than current devices. The sensor is self-monitoring, so in real time the device knows how much volume is being displaced, and if there's something wrong with the internal mechanism or something's off, it will alert you. And the sensor calibrates itself, so you don't need to pay for costly calibration or ever worry that your pipette is not performing well ever again. So here are some specs. We have the Eppendorf motorized pipette here, and these are its official stats, which would happen at the time of calibration. So it's plus minus 30 nanoliters at a 0.5 microliter target volume, and it's plus minus 100 nanoliters for a 10 microliter target volume. Using our sensor, we can make a pipette that goes to 10 microliters that has a plus minus 8 nanoliter volume at all times. Not just at time of calibration. And our sensor, including the motor and all the other parts, costs us about $100 in Canadian dollars. And that already beats the Eppendorf thing, like way a hell of a lot. And yeah, and obviously we beat the manual guys. Like if you're using your thumbs, I'll pray for you. So we can make a handheld device or a standalone tool head thing that can go in a robot. So here's a little picture of it in a robot. It would be about the size of a deck of cards using our current prototype, but that will shrink down as our tech gets better. Just like all consumer electronics eventually shrink down. And yeah, here's our prototype. So a lot of it's blurred out, but you can see it's screwed into wood and there's wire sticking out of it. And that's a little microcontroller module that runs the thing. So that, our very first prototype cost us $30 to make. And we're gonna get better and better. So thank you. And I'll be talking to you in real life now.
I think you nailed it. You know, the demo video. Next
you.
time, just lip sync it. Just play the video and just, make all those gestures. You're done with it now. But tell us about the precision before we, ask questions. What kind of precision we are talking about here? Because I know it's still not just a drop, but even a drop, you mentioned there's so much more precision, right?
Yeah, so for scale, a teardrop that falls out of your eyeball would be about 20 to 40 microliters in size. And the standard reaction volume, if you're doing biochemical reactions, it's usually between 50 to 25 microliters total volume. So you'd have 5 or 6 components, like 10 microliters of this, 5 microliters of this, usually 1 microliter or a half a microliter of the expensive thing, like the enzyme or the antibody that you're actually paying a lot of money for and don't want to lose. And as life science and biotech gets better, the reaction size keeps shrinking. People want more throughput, they want to run more reactions with the same amount of materials, and they're just being limited by the precision of their pipettes, because if they're shrinking the reaction volume, the error becomes relatively larger, right? So if your reaction volume is 20 microliters and you're plus minus 1 microliter, it's a lot bigger error than if your reaction volume is 50 microliters and you're plus minus 1 microliter. So yeah, and it's not even just that. I was just in the lab, people going like this, sitting in front of their tubes hours on end, it's just really, really frustrating, and how much manual labor is involved in cutting edge cancer research. It's still just sitting around using your thumbs to do stuff. It drove me nuts.
That's why you pray for them.
Yeah.
So, panelists, Jane, I just want to take your thoughts once, if that's okay, because you mentioned something while we were talking that, you're trying to platformize a lot of these solutions, right? Early stage. And knowing Rana is at very early stage, you saw what he's building, where exactly is. What kind of help does your platform also provide to founders like that at this stage?
Yeah, I don't know if I can distribute medical device on our platform. I think it'd be more helpful for Aziz's product because we have consumer users that are on it. But first of all, my background is biochem out of McGill.
Yeah, me too.
I have suffered through a lot of agar gels and pipetting. Okay, so I want to talk a little bit about your. I think you're right. Getting the IP, getting the patents are really, really important. And then two, have you thought about kind of the medical device distribution? Because I think that would be the second step. That would be the important part of what you're doing, right?
Yep. So all micropipette manufacturers, they have both through distribution channels and direct to consumer, from their website. So you and I, we could just go on Eppendorf's website right now and buy a micropipette and they'll just ship it to you. But there's also big labs, at universities and hospitals. They have a procurement department that does a big purchase. So they usually go with a distributor that has lots of different devices, lab devices for sale, centrifuges, shakers, heat plates, and also consumables like the tips, tubes, various salt solutions and stuff like that. So they do a big buy, right? So those big, rich customers, they would buy exclusively through distributors.
Yeah, that makes sense. So there's people that specialize in selling to that. So kind of think through what your hires would be, which comes to kind of the capital burn. Let's talk about your company beyond the product. Have you raised money for it? What does that look like?
No, my co-founder, Zach, he's sitting right there with his lovely wife, Shubi. Him and I are burning our savings. We're just eating rice and beans every day. We get like
$30. I mean.
Yeah, I know. That's like a week's worth of groceries for us. Yeah, we're bootstrapping it completely. We might do a small friends and family round in the new year, depending. But we're hoping we have enough cash to get us through our demo device and our patent and a couple months of like showing it off. So like going around the GTA to universities, do some hands-on demos with people, get some eyeballs on it, and then we'll have to take it from there.
Yeah, I have a pretty good network out of like Stanford and some of the U.S. Distribution, so I think we should take a look at that. I'd be happy to invest.
Yeah, that'd be great.
Yeah. Awesome. Thank you.
So my question is, how did you ever come up with this idea? Like, was it something that injured you in your actual lab work? No, I'm just curious, like, is this a problem that people complain about a lot?
Yeah. So I was emotionally injured. But yeah, people complain all the time. So it's in our longer pitch deck. The grad students, they will guard their pipettes. They will be like, I need good data this week. Don't touch my pipettes. They were just calibrated, right? And you could be like doing reactions and someone walks by and be like, oh yeah, the undergrad dropped that yesterday, so you might want to watch out. And you're just like, oh God, why? And yeah, people complain all the time. When bad data comes back, the pipette's the first thing to get blamed.
So the impact, like when it's by a pharma company, is that things get slower, more like dirty, whatever.
Yep.
So do you have any people in those large pharma that would, like, is there someone that's a champion for you that's had this problem that can even speak to it?
Yeah. So in private industry, so in medical settings, like clinical diagnostics, for example, when you get your blood drawn and they send it to the lab, right? It's like literally a person with a pipette, like doing reactions on it, taking a little sample, mixing it with stuff. So those places, we actually spoke to our market research. We spoke to a lady who ran the toxicology lab at SickKids, and they have very strict processes in place to calibrate their pipettes and to spot check their pipettes before each shift. And they calibrate them once a week because if the pipettes are off and like bad results come back and get shipped out to the patient, it's like really, really bad. It's like somebody's health is on the line and they can get sued. So yeah, they would love this, but to use a device in a clinical setting, the factory it's made in has to have these other certifications. So we're definitely looking into that. We know that we need those. And yeah, our business advisor helps clinical trials like submit their paperwork. And some of that is people using a micropipette to make doses to give to the trial participants. And they have to submit all this paperwork of when the pipette was maintained, when it was calibrated, when they spot checked it, who was the operator, because each operator is a little bit different. And sometimes there are some horror stories with that where they forgot to calibrate, or like the guy, he was hungover or something, he was mixing reactions and it wasn't going well, and they gave him to patients and the data came back like all bad. And they have to like redo it, and that costs tens, hundreds of thousands of dollars.
So that didn't come through for me initially. I get it now. Like, it could be a dramatically awful thing to happen, right? So, but you have some people who can tell that story at the same time that you're going for your device certification and IP on that and stuff. So that's,
yeah.
I would just really encourage you to tell the story bigger, because sadly, those people are not making the pricing, the buying decisions, right? Like, you've got these big procurement. So you need some noise to like make this a real problem, unless I'm the only one that doesn't.
Yeah. If anybody has horror stories on pipettes, email us. We would love to hear them.
I think one of the reasons Rana was here was actually looking for someone in business development. I think you mentioned like that's kind of your goal for 2026, right? To find more people that can take the sensor and the products out and just see what can be done with it. I guess I had a really short question for you.
Yeah.
Why micropipettes? Because from your demo, it kind of seems like the innovation is the sensor.
Yeah, that is correct. Yeah, so the innovation is the sensor. The micropipette is just the low-hanging fruit right now because they're the most widely used lab device in the world. There's tens of millions of these things in existence. So yeah, we can make a better one using the sensor, but the goal is lab automation at the end of the day. Like, I don't want somebody there holding my thing, doing stuff. It's like, what? Just make it a robot. Like, we can easily shove that thing onto an XYZ system, have it go up and down, do stuff. So yeah, the goal is lab automation, and Zach and I were brainstorming the other day, and we have a new kind of lab liquid handler that's never made before, I've never ever seen or even heard of, and we can make a new kind of lab liquid handler using this sensor. And it would actually be amazing. I can't give it away, but when our patent comes back, we'll definitely be advertising that. And yeah, the dream is automation. It's to remove, the human element.
I'm saying that's how you tell your TAM, right?
Yeah.
Like how big it is. But just one quick question from anybody. Brian?
Now I understand why I failed analytical chemistry. The micropipettes.
Yeah.
Quick question. Hardware's hard, so why focus on hardware? Why not license the tech to manufacturers?
Yeah, we could do that. I'm not against that. Yeah. Know anybody? Yeah. I mean, we could license, I like money, so.
Yeah, there's someone I think you should talk to for the automation piece.
Okay.
Big
Sweet,
Canadian manufacturer.
That'd be great, yeah. Let's
Awesome.
chat.
Thank you. Thank you so much, Rana.
Thanks.
That was amazing.